What's up, Snackcasters? Welcome back. So we actually have a special guest today. He came in the office to meet with a few people, and we got to talking, and it was like, man, you need to come in here and talk to our viewers.
Why not?
Right? So this is Dr. Graham Kern. Doc, why don't you tell them a little bit about yourself?
Yes, I'm a chiropractic physician here in Lakeland, and we have an office we're on the south end of Lakeland, and actually not too far from where we are here today. So we do a lot of great things in the office, and we've had an opportunity this morning to try to talk to each other.
Good.
And kind of open our eyes a little bit to some things that we could do to try to help people out there in the community.
Yeah. So tell everybody the name of your practice, just in case somebody local wanted to
we're
look it up.
Lakeland Disc Center. We're also under Kern Chiropractic Clinic too, obviously, because I am a chiropractor, but do a lot of general chiropractic care in our office. A lot of people think chiropractic is just about neck and back.
I was going to ask that. I know for you, it's so much more. So
Yes.
spill a little bit of those.
Yeah. So I think probably we've done a poor job as a profession really explaining what chiropractic is, but bottom line is it's way more than neck and back pain. And it's really about the nervous system and taking pressure off the nervous system so that a person can function better, health-wise and even performance-wise is probably the simplest way to try to explain it.
So you say it's more than back and neck. I know some of the stuff you were telling me, and I don't really know how to set up this question, I guess, but it's a lot of there's a lot of the mind that's involved.
Yeah, for sure. So, the nervous system is made up of your brain and your spinal cord. And then all the nerves are traveling out of your spine and going to every organ and tissue in your body. And your brain controls everything. It's your hard drive of your body. Yeah. So when I say take stress off, a lot of times people have a spinal problem, and a lot of times they're not symptomatic, they don't have pain or anything, but really probably what drives most of our people into the office is neck and back pain. But then all of a sudden they start noticing improvement in their health. Right. I'm not going to the bathroom as much, or I don't have the heartburn or indigestion that I used to have.
Well, you mentioned earlier you had one guy that came in for a treatment or treatments, I don't know, but he started just losing weight and he changed no behavior.
Yeah. He came in, he was doing chiropractic care, and he's losing weight. And I see his jeans are baggy, and I'm like, what are you doing? He's like, I've not done anything. All I've done is added chiropractic care. So it can have now the trick is if we could figure out how we could do that for everybody, right? Like, does everybody lose weight? Well, no, but everybody's body is different and it functions different, and there's different stressors. And so we're really trying to remove that.
So it's interesting. Kevin and I, we did this whole mind over medicine, and one of the core tenets was stressors, and how they really can wreck the body and the mind.
Yes, for sure. Yeah. And we're all under stress, and what can we do to be healthy is to try to remove as much of that stress, whether it's through our diet, through exercise, and actually, chiropractic care can be part of that health pie that I call.
Right.
Yeah,
right.
For sure.
So beyond chiropractic, you mentioned you also do decompression. What really is that?
Yeah. So I specialize in spinal disc injury. So there's a lot of people out there that have a disc injury, like a bulging or herniated disc. That disc is that spongy material in between the bones. And over time, that disc can get compressed and it can start putting pressure on that nerve. So a lot of people with sciatic type of pain, or numbness or tingling in their legs, numbness and tingling in their arms and hands, it's coming from a disc. And so that disc we have to treat very specifically, and how we do that is through a procedure known as non-surgical spinal decompression
Big
therapy.
fan.
Fan of that. So my mission, every day I wake up, my mission is to try to help as many people in our community avoid the narcotics, the opiates, the injections, and ultimately spinal surgery.
So when you go to the surgeon and he recommends surgery, we shouldn't be surprised about that, right?
No, right? I mean, come on, that's where the money's made, right? But the bottom, really, even beyond that, man, is once you do surgery, and I'm not saying there's cases where you don't have to have it, but once you do it, it's never the same. And in many cases, you open up a can of worms. It's 80% of low back procedures end up in multiple procedures.
Yeah, but
so it's down. You're going down a slippery slope. So we're just trying to prevent that as best we can.
Yeah, close family member has dealt with that.
Yeah.
Yeah. And it's no fun.
Yeah. So decompression is a big part of our practice. A lot of people are coming in with neck and back pain. They don't know what they have. We ultimately do, the appropriate imaging and get the appropriate evaluation done and diagnose them properly. That's the key thing. Then we know we can give them the right treatment for their problem.
So it's really patient-centered care.
Absolutely.
Which is so counter from what we see a lot in our traditional.
Right. And just trying to do it as naturally as we possibly can. I mean, our bodies are designed, wonderfully designed, and we're a complex machine, and it's designed to heal itself. A lot of times it just needs the right intervention.
Yeah.
And this is a non-invasive approach to try to help people with that.
Love it.
Love it. Yep.
So I think the last thing you talked about is kind of one of your core competencies is soft wave therapy.
Yeah. So, man, we are so excited about the soft wave therapy that we have. This technology has only been in the U.S. for about 2.5 years. It's been in Europe for almost 15. And it's an unbelievable therapy for people, again, non-invasive, to try to help people with all sorts of different injuries, shoulder, knee, back, spinal issues, ankles, plantar fasciitis, all these different conditions. And so we are just blessed to have this piece of equipment in our office. It's a regenerative therapy, if you will, and has been shown to stimulate a person's own stem cells for long-term healing. And again, it's not an invasive procedure like an injection. And
right.
It's just been a wonderful thing. Practice is really fun.
Does it hurt?
No. Well, there's parts of the therapy that hurt, but what's amazing about it is by the end of the treatment, they're like, I don't hurt anymore, and the pain is dramatically reduced. And the wonderful thing is usually after I do one treatment on them, I'm going to know whether or not it's going to be able to help them.
Oh, well, that's cool.
Yeah. Not wasting time, not wasting money.
Right.
Right. And I would say 90 to 95% of the people that we do a treatment with soft wave therapy with on them, they get up and they've either got better range of motion or decreased pain or both. And it's fun, man. It's smiles on people's faces.
This is chronic knee pain.
Oh yeah,
chronic
knee
back
pain. Yep, knee, shoulder. Knees and shoulders are huge, obviously, because those are probably most common joints injured.
Yeah.
But the other side of that, again, if there's a severe injury, then we got to make sure we know what we're dealing with for sure.
Right. Yeah. So I think about that. My father, maybe 15, 20 years ago now, but he ruptured his Achilles in a complete rupture.
Yeah.
That's got to be surgery.
Sure. That's why we need the surgeons and the doctors, and total respect for them. But man, what we can do for those people after. So if they have to have a procedure done like that, we can cut that healing time down dramatically with this therapy. Cool. Yeah. So get people back on the field or put people back on the court or whatever it is from a performance standpoint. But just a little old grandma too that has something like that, we can help.
So do you think that this is out of the blue? You're not expecting it. It just popped in my head. Is there any fibromyalgia? It's such a weird, nobody can figure it out, can diagnose it.
And fibro's tough because there's true legitimate fibromyalgia, but a lot of times, unfortunately, it's a catch-all diagnosis. Right? They don't really know what's wrong with the person, and then they're like, "Oh, you just got fibro." And so a situation like that, again, you've got to be sure they're diagnosed properly. And I think that's what's happening a lot out there is people are being misdiagnosed, overprescribed and over-medicated and over-tested.
Yep.
So we're a facility to try to eliminate as much of that as we possibly can and really get to the root and cause of the person's problem.
Yeah.
For sure.
Dude, that's awesome.
Yeah.
And I appreciate you coming in today.
I appreciate it. This was spur of the moment, but it worked out good.
It was.
I really appreciate it. And if, we're lakelanddisccenter.com. There's a ton of information on there. We're in South Lakeland on Cleveland Heights Boulevard. So if there's anybody out there that sees this, that we could try to help, I'm genuinely here to try to help you. So thanks so much for offering for me to talk today.
You got it, man. Awesome. I enjoyed it. It was a pleasure meeting you.
All right. Good
Questions, comments, concerns, hit us up at snackcast@yes.fit. Also, if you would like more instruction on how to contact Dr. Kern, we'd be happy to help. Snackcast@yes.fit. Stay moving and see you.